So my name's Emily, lovely to meet you all. We are here to learn about something really, really important, which is first aid. Now our body is very good at healing itself. However, sometimes it needs a little bit of help. And today I've got some helpers with me. I've got Ellie the elephant. Say hi, Ellie. Oh, she's waving at you. She's my trainee first aid instructor. And I've got little Anne over here. Now little Anne walks around with her eyes closed all day long, which is why she gets so many small ouchies. Now, before we do begin, I just want to make sure you've got everything that you need. Okay, right, we're going to start off with a small cut that you might have, maybe to the knee, maybe you've fallen over. Oh, sorry, I should say the word ouchie. Cut sounds a bit scary, doesn't it? So we've got a small little ouchie on our knee. Thank you, Ellie. Oh, Ellie can't look at it now. I know. Well, the first thing we need to do is make sure we're brave. I want to be brave because it's going to hurt a little bit, this little ouchie. But we're very, very brave. And then I want you to remember the word red. So every time I shout code, you are going to shout red. And I'm wearing my red shorts for that very reason, so you do not forget. So code red means R for rest, which means I'm sitting down. And then E means examine it. So I'm going to examine it. Examine means look at it. And if it's dirty, you might need to get some water, maybe out your water bottle, and you need to be able to wash the wound over like that. Maybe don't actually throw water over yourselves, like I just decided to soak the carpet. So we've washed it away, which is all good, and then we need to go and get a sterile dressing. I know, sorry, Ellie was just saying they might not know what sterile means. Well, sterile means that it needs to be nice and clean. So we've got a nice big clean dressing, so I've got this one here, it's like a big plaster. I'm going to peel it off and I'm going to make sure that I put it straight on the wound. And you notice I've not actually touched the wound with my hands because my hands might be dirty. We might not have time to wash them, so we're going to put this straight on the wound like that, and then we're going to seal it all the way around like so. And hopefully I'm going to be nice and brave and that's not going to hurt me too much. Right, now this is where you're going to start helping me at home, because this time, oh, I've got a bigger cut. And a bigger cut. Remember, what's that word that we need to do? Can you remember? Yeah, it's code red. Remember, rest, examine, and dress. So D for dress. So I've got a big cut on my leg. Now this one's really big. And my hands are dirty, so I don't want to touch it because I'm maybe kind of put dirt in there and that will hurt even more. So the first thing we have to do is make sure we wash our hands. Now I'm pretty sure at school you've all been doing lots of washing your hands, so you know how to do that. And then if you have some gloves, it's a good idea to put gloves on, but don't worry if you're not. Maybe you can get a plastic bag, because you don't really want to be touching somebody else's blood. If it's your own, that's okay, but if it's somebody else, maybe put your hand in a plastic bag and then ask them to put pressure on it like that. Okay, so they're resting it, we've examined it, and we've kind of dressed it already because we put pressure on there. Well, then the next thing we're going to do is go and get a dressing. Now, imagine my hand's still on there. This here is a dressing. Now, if you haven't got a dressing like this, you can use a scarf, a tea towel, whatever you like. I'm just going to show you how to use one of these, because some of you might have them at school or in first aid kits. You're going to put that dressing straight on the wound. So remember, code red, rest them, examine, and dress. Remember, I'm being brave, and we've gone code red, rest them, examine it, and now we're dressing. So we're dressing the bandage around me. And the trick with this is to make sure you cover all of the dressing as best as you possibly can. So wrap it around like so, all the way around, and then you're going to try and tie a knot, or if you're very good, you might be able to tie a nice pretty bow. Perfect. Now if you haven't got a bandage like that, don't panic, because I'm sure girls, school tights, you probably have something like this. Boys, you maybe can go and borrow some of your sisters, maybe you have leggings or PE tights, or if you don't have that, maybe you've got a tea towel at home. So we can put tights on instead, if you like, over the wound, and we can just tie them around. So maybe you can do this with me. So you've got a big cut on your legs like so, and we're going to go all the way around, and you're going to put lots of pressure on there. Okay, not too tight that it's going to hurt, but enough on there to stop the bleeding, like so. Okay, you've got to make sure you cover the bleeding. You don't want to see any blood, okay? Now, if you do see blood coming through there, then what you've got to make sure you do then is get your tea towel or another scarf, and you're going to put another dressing over the top. So 2 dressings. And if it's still coming for the second one, you need to take it off and start again. And it's really important this time that you go and get someone to come and help you. And if it's really bad, hopefully you'll remember, we need to call the ambulance on 999. And some of you might also know the other number that you can use anywhere in Europe. So 112 also works. But in the UK, you can call 999 if we need the ambulance. Right, we're going to move on then to maybe an arm injury, because over here, little Anne's been sitting very quietly over here, but actually, Anne, you didn't tell me, but you've actually got a cut on your arm there. So if this was somebody else I'm treating, rather than me, I'll be making sure I reassure them, because I want them to be a brave little soldier. Are you okay, Anne? Yeah? Okay, the first thing I remember is code red. So she's resting already. I'm then going to examine the wound, have a look. And I'm going to put my gloves on because this is not my blood. I don't really want to be touching, so I'm going to put my gloves on this time. And we're going to get anything we can to put some dressing on there, but lots of pressure. So this time we can use our scarf. So we're going to get our scarf out and I'm going to wrap it all the way around, making sure I don't hurt. And go, you okay, Anne? Yeah, everything's okay. I know Ellie's over there, she's watching, don't worry. And we're going to put lots of pressure on there. It's not too tight, is it? No, that's good. Thankfully it's not too tight for her. And then we'll put it on and then we're going to tie it into place. Oh, well done, Anne. So brave. And then if it's not too sore, I'm going to ask her to elevate it. So can you just hold that up there, Anne? Perfect. And if you just put your thumb inside there, because if they put their thumb there, that will kind of elevate it for them. Yeah, okay, you can just hold that there. Oh, right. Sorry, Ellie's just speaking to me. What did you say, Ellie? Oh, she just said that Anne's feeling a bit dizzy. Her face has gone very pale. Anne, I noticed your face very pale. Are you okay? Well, she says she's not. So I'm going to make sure I shout for help to get someone to come and help me. Help, please. And then I'm going to say, Anne, can you just lay down? So we're going to lay Anne down like so, very carefully. Because this is saying, that says, if the face goes pale, we're going to raise their tail. Now, Anne doesn't have any legs. So I'll quickly show you on me. So up we go, I'm going to lay down. Forget Anne's there. I'm going to put my legs up in the air. Like so. Now she's telling me that she's feeling a bit cold, Anne is. Okay, don't worry, Anne. What I'm going to do, I'm going to give you a blanket. Because for the older ones amongst you, you should hopefully realise actually, when you lose too much blood, then you can suffer from shock. And we don't want to be doing that. So we're going to make sure we've treated the bleeding. She's feeling a bit dizzy, so we're laying her down. And then we've lifted her legs and we're keeping her nice and warm. And we're sitting there, just reassuring her, making sure she's okay. You okay, Anne? Don't worry. Yeah, Ellie's here as well, I know. Yeah, we're all here looking after you. Right, we're going to move on then to other places where we can have some dressings. Now, we've done an arm, we've done a knee, we've done a leg. Where else have you hurt yourself? Oh, have you? Ellie's just told me she hits her nose quite a lot. Well, that's because your nose is really big, Ellie. Yeah, so let's sit Anne up. Anne's feeling much better now. We've treated that bleed. And so up we go, Anne. Perfect. Now, I know I've hurt my nose, and sometimes it's because I've kind of fallen over and hit my nose. So what we need to do, make sure we pinch the nose. So on Ellie, it's nice and easy because she can just pinch her own nose like that. And I can pinch my own nose. It makes you speak a little bit funny. But don't worry, just make sure you pinch your nose and you keep pinching it for about 10 minutes. And you might just need to lean them forward slightly. Never, ever, 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 ever put your head back. But if there is a bit of blood coming out, you might just get a little tea towel and just hold it underneath. So remember, nosebleed, pinch your nose until they speak funny. Have something underneath just to catch any bits of blood and lean forwards. And if they've got a nosebleed because they've hit their head, please make sure you go and see a doctor. But sometimes people get a nosebleed, and children, mainly you, because you've been picking your nose, which you don't want to be doing, because it's, you know, you've got lots of little thin blood vessels up there, and it can cause an infection if you do that. So please do not do that. Okay, the last bit of bleeding I want to just focus on is a head injury. So if Anne over here, let's just say Anne, remember, she can't see, she keeps walking around, she just walked into the door now. Silly Anne, she's now got a head injury. Hopefully you all remember the word, code red. Remember, rest her. We're examining the wound. If we can't examine it because it's dirty, we're going to put some water over it. And then we're going to dress the wound. Now this is my favourite bit, and it's where you make each other look a bit like pirates. So you can use whatever you've got, whether it's your tea towel, or maybe some of you actually have a triangular bandage, anything, pillowcase, t-shirt, whatever you've got, you just need to make sure you cover that head so you can't see that blood. So here we are, little hand's over there. I know your arm's there, just pretend her arm's better. I'm going to lean up against me. So I get my triangular bandage or whatever dressing you've got, and you make sure that you put it over the head like that so you can't see it. Don't try and cover their eyes, or don't wrap it around their head so they can't see, because if you go like this, they're not going to be able to see anything, and they want to be able to see where they're going. And please don't worry about messing your hair up. I am demonstrating now on hand so I don't mess my hair up. Took a while to get my hair to look like this morning. So here we go. We've got a triangular bandage all the way around, and then we change over the back. So we switch the ends at the back, and we come all the way back to the front, and we put pressure on the wound. So remember, she's resting. We've examined it, and we put a dressing on there, which puts lots of pressure on the wound. And I think she looks kind of funky as well. Yeah, so there we go. I'll just turn it around so you can see what the back looks like. So you've got this bit here, you can pull down to make it even tighter if you wish to. Or of course, if you just wanted to use a normal dressing, stay there, Anne. If you just wanted to use a normal dressing, you can maybe make it smaller. So you can maybe fold it in half, and you can maybe just put a dressing all the way around their head, like so. You just got to make sure that you cover the blood. You don't want to see any of that blood all the way around. Maybe you don't want to cover the eyes, just try and cover where that head wound actually is. Okay? So, key words I want you to remember. Sterile means clean. And make sure if you've got no gloves, what do we need to get? Yeah, well done. A plastic bag or something to cover the wound if you don't have any gloves. And then you want to make sure, remember the word code. Red meaning rest, examine it and dress. And if the bleeding is so bad you can't stop it, you're going to call 999 and shout for someone to come and help you. Okay? Now, if you've got something which is a little bit gruesome, but if you've got a big ouchie and there's something stuck in the middle of your ouchie, like this, it's a nail. Don't worry, it's not a real one. I'll show you just in case you get a bit worried. It's not a real one. But if you do have something stuck in a wound, please don't take it out. You must make sure you leave it in there, and you must make sure you go and see a doctor or go to hospital as quick as possible. Okay? Because if you pull it out, you're going to make it a lot worse. And you might fall on things, maybe if you're out cycling, you don't want to be falling over, maybe it's like a handlebar. Just leave it exactly where it is. Do not pull it out. Okay? Right, the last thing I want to cover with you all today then is fractures. And that's a big word. Ellie's just telling me, I know, I'll tell you what it means, Ellie. Fracture means a broken bone. So if you've broken your bone, you might not know it's broken because only those x-ray machines can tell us, but sometimes it'll be really sore. So if I've broken my arm, it's going to be very sore, but I'm going to make sure I'm really brave, and I'm going to make sure I keep it still. I don't want to move it, because if I move it, I'm going to make it worse. So I'm just going to hold it in place like so. Or if I need to move, maybe to go to hospital, because I might need to get it x-rayed, excuse my belly, I'm just going to sit up so you can all see. You can make a sling by using your t-shirt. I'll try not to expose my belly. Like so, and maybe just safely pin it or just get them to hold it there. And that kind of makes a nice little sling for yourself. Or if their arm is in this position, normally it can mean they've hurt their shoulder or this bone here. Some of you might know the name of it. It's called your clavicle or your collarbone. And you can just get them to put their hand inside their t-shirt, and that will be able to support this arm in this position. But it's so important if they have broken a bone that they keep it still. So a finger, make sure they strap it up to the next one and you keep it still. Okay? Right guys, I just want to say thank you so much for all of you that have been listening. A big thank you for Anne, big thank you from Ellie as well, and myself. My name's Emily.